Welcome back, everyone. Many women either ignore heart attack symptoms or they don't recognize them, and this can be deadly. Heart disease kills more women than breast cancer.
Joining us now is Dr. Srinivas Iyengar from the Bradenton Cardiology Center to talk about the symptoms and what you have to do if you have any of them. Good to have you here again.
Thanks for having me back.
More than breast cancer. It's very important to make that hit home with everyone.
And that's exactly true, because the thing is that breast cancer is something of a gender specific in a lot of ways, but it affects men too. But women tend to obviously talk about it a lot. Heart disease, though, kills more women than breast cancer.
Wow.
So we have to bring that to the forefront. Let women know that this affects them more so than anything else.
And a lot of people have these symptoms and they don't either want to believe that they're having, a heart attack, or that they have heart disease, and they also don't want to. Well, as mothers, as employees, as everything.
As everything. That's the best way to say it. Women are caretakers. And a lot of times they don't want to complain.
Right.
And men, classic teaching that men have with heart attacks, the elephant sitting on the chest, the left arm pain, the sweating, these things that happen on the golf course, shall we say, to the 50-year-old male.
Yeah.
Women tend to have different types of symptoms. And that includes flu-like symptoms, indigestion, sometimes chest pain that is actually in the belly region, so they thought it's more or less gastric or indigestion. So when these happen, I'm not saying that every woman should rush to the emergency room, but I 100 times prefer a woman to come to the office and see me and have me tell her it's indigestion than have her sit at home and have a heart attack.
We're looking at a list right now of female heart attack symptoms, and you mentioned chest discomfort with and lightheadedness.
Absolutely. Lightheadedness is something that comes along, and many people get lightheadedness. How do we differentiate a lightheaded heart attack from lightheadedness benign? If it's different, if it's sudden, if it's onset, there's nothing to explain it, that would be something I'd be more concerned about.
But what about, a lot of women feel lightheaded. From sitting down, standing up, a lot of people do in general. You said if it's different. What if you've, never felt it before?
Perfect example. Know your body. If you know that you've never had this episode before, if you've gone up from a seating position and get lightheaded, that's normal.
Okay.
But if you're watching TV, if you're basically sitting and just doing nothing specific and you get this symptom, that is something that we should be concerned about. And like I said, it's better to be told you have nothing wrong than to be at home thinking you have nothing wrong and actually have a heart attack.
All right, we're going to go through some more of the symptoms here. Fainting, obviously, if you faint, well, then there's something going on. So you really have to get that checked. Sweating. And you're not just talking about if it's hot outside and it's humid.
Or heat flashes.
Exactly. I'm not talking about hot flashes, and I'm not talking just because it's hot outside. Something that's completely out of the blue.
Yeah, okay. Unexplained fatigue.
And that's something that's a little bit harder, because sometimes women will say, you know what, I'm just more tired daily. But that might be an early sign that something else is going on, other than the heart too. Thyroid dysfunction, anemia, these are other things that women suffer from. So you should be checked up for other things in addition.
A really interesting symptom is back pain.
Now, the heart is connected to the aorta, which is the largest vessel in the body. So oftentimes when people have chest pain, it radiates into that vessel. So it can cause different types of radiation of pain to the back, to the chest, to the abdomen. So you can actually have varying feelings of pain from the heart.
All right. You say pressure in the lower chest is often confused with a stomach issue. Some people might think I've got heartburn.
And that's
acid reflux.
Yeah.
And oftentimes I'll see patients in the emergency room with coatings of Tums or Rolaids or something around their mouth when they're actually having a heart attack. If you do have indigestion or a history of heartburn, fine. But the fact is, heartburn is something benign that we can treat over the counter. A heart attack needs to be seen by a specialist or in the emergency room.
Finally, dizziness.
And just go back to the lightheadedness and fainting. If that's new and it's different, get seen by someone, because that's obviously something is perturbed in your system. So we can't explain that away necessarily.
If you feel a lot of these symptoms, obviously, and we're talking about them, if you feel a lot of them, yes, you'll probably go to the emergency room. But what if you just feel one?
That's something when it comes down to knowing your body specifically.
As you said, right.
Because if you are someone who says at home, if you're watching TV and one of these symptoms comes on, obviously we're not going to tell you that you're having a heart attack, but I'm going to tell you something happened. And what happened, we need to explain further. So it's something of your body that you'll have to be aware of. Additionally, we have to really take the people at home watching should really understand this. Women have 20% higher mortality rate after a heart attack in the first year compared to men. Why is that? Because women oftentimes downplay the symptoms.
Right, and they think, I don't have time for this right now.
Right.
We're all guilty of that,
Yep.
and they just don't go, and that's it could be deadly.
And absolutely, and they need to basically get some help if they're having these symptoms.
All right, Dr. Iyengar, thank you very much. Very important.
See you again very, very soon. Still ahead on Daytime, the latest celebrity news from our friends at Extra, so stay with us.